go. Welcome everybody to another episode of The Big Idea. I'm your host, Dr. Jeffrey Hanna at Atlas Health here in North Lakes in Brisbane, where what we do is we take a pretty convoluted topic, look at a little bit of research, and try to distill the big idea from it. To take it, and maybe take a little bit longer than we need to, but take it through some of the most important points so that you can actually understand it. So these videos, we do them for two people. Number one, healthcare practitioners who really do need to know this information, but arguably more important for the individual who might be experiencing some of these issues who aren't finding the right kind of information in other places. So we try to take the idea and then put it into English as good as we can and also explain a little bit of the process, what it means, and most importantly, what you can do about that. And today, we've actually talked about and alluded to this particular order on a number of these videos that we've done over the course of the year, but everything conspires, it all coming together. Today is the day. The role of the Craniocervical Junction in Craniospinal Hydrodynamics and Neurodegenerative Conditions by Dr. Michael Flanagan. I believe he had passed away probably the better part now of around, it was probably about 7 years ago. Now, very, very unfortunate loss for not just my profession, but for the world, as he had a lot of very cutting-edge ideas in terms of doing a lot of evolutionary and anthropomorphic study, bone specimens, and tying it together in terms of neurology, anatomy, and clinical practice in ways that a lot of people really didn't do in being able to connect the dots in a lot of different ideas. And so his work is basically the bedrock, and he is still very commonly cited in terms of a lot of different conditions, based in large part on his thesis or one of these papers that he published back in 2015. So without further ado, let's go ahead and jump into it. Ready? Here we go. The craniocervical junction is a potential choke point for craniospinal hydrodynamics and may play a causative or contributory role in the pathogenesis and progression of neurodegenerative diseases such as Alzheimer's, Parkinson's, multiple sclerosis, ALS, aka Lou Gehrig's disease, anterolateral sclerosis, or here in Australia, motor neuron disease, as well as many other neurological conditions including hydrocephalus, idiopathic intracranial hypertension, migraines, seizures, silent strokes, affective disorders, schizophrenia, and psychosis. Now that is quite a bit of a mouthful right there, and that's also a very bold statement to be coming out of the gates with that. Because as you're seeing here, a good chunk of these conditions, we honestly still do not know exactly what causes these things. What Dr. Flanagan is proposing here, he is not saying an absolute, but what he is talking about is he's talking about how one of at least the contributing factors, and maybe one of the major causative factors for this, is if and when a person has an issue going on where their head meets their neck. In other words, it's not just stress, it's not just chemicals, that there can be a physical cause for this. And where there may be a physical cause, there may also be a physical solution. So this is what we're going to kind of look at in this particular article. Not absolutes, but I want you to think of it in terms of possibilities based on being able to connect some of these different dots. And we'll try to do that the very best that we can here for you. Now, I will do a quick pause, as we always do here anyway, because even if in this video already I've said something where you're thinking, okay, whoa, this actually sounds kind of interesting, well, make sure that you watch this video all the way through to the end. But number two, what we're going to ask you to do is ask you to like and then join this particular channel. Why would you do that? A, if you find value in this, okay, good, it helps us out. But more importantly, with the computer algorithm, it helps it so that other people who are looking for this kind of information are actually going to be able to find this, watch this video for themselves. So I ask you to do this to help out other people. So let's have a look at a few of these things. And I think that what we're going to do firstly is we're actually just going to go through the abstract or the summary at the beginning of this and let you know what some of these conditions are, because you may have heard of some of these but may not be uber familiar. Alzheimer's disease. This is where we are having atrophy or breakdown of brain tissue. Usually shows up in a more elderly population, not because they are old, we're seeing this in younger people, but degeneration of brain tissue itself resulting in memory loss, altered motor function, and all the kinds of associated, including personality kinds of issues. Most of us are familiar with this. Parkinson's disease. This is where you have the basically degeneration of particular centers of the brain, what's called the substantia nigra, and also some of what are called extrapyramidal nuclei. There are the centers of your brain that are responsible for gross motor movement, and then you have the kind that are involved in fine motor coordination. This is where you're having either degeneration of the brain or imbalances among neurotransmitters, where you have the major movements, but where the fine motor ones start to go funny like this. And where you have degeneration in one part of the brain, odds are it's going to be affecting another. So this is predominantly affecting things on a motor side of the equation, but there's also a lot of overlap with mental and sensory as well. Multiple sclerosis. This is where the normal conductions, or basically the insulation that you would see around nerve cells, like the little bit of sheath that you would see around electrical wire, starts to fray. And where it starts to fray, the body lays down connective tissue, or scar tissue more appropriately, over that. The consequence of that is that the normal signals that should be shooting are not firing the way that they should be. And the consequence is that you see all kinds of different neurological symptoms any and everywhere all over the body. They very frequently do not make sense. And when a person's had an MRI scan and they say, these are the brain lesions that are characteristic of that, that's how that diagnosis is made. Okay, we are dealing with a demyelinating condition. Very similar is anterolateral sclerosis. This is where, in particular, you're seeing the fraying of the motor nerves. And this is why it is also such a terrible condition, is because a person is still able to feel. They're still able to experience, and their mind is still completely sharp. But their body ceases to move. And they are quite literally locked in to their life until ultimately, and this is the tragedy of it, and this is true for a lot of these conditions, is when, especially when the mind is still working, but it's that the muscles themselves that are responsible for your swallowing, your speech, and your breathing, it's when those fail to work, so people quite literally choke to death, which is why this one here is so particularly insidious in my opinion. I don't wish this on anybody. Even my worst enemy, I do not wish this on them. Hydrocephalus. We'll talk about this one a little bit later, but in brief, what it means there's too much fluid inside of the cranial vault. And the cranial vault, even though it is designed to move just a wee little bit, like the width of a piece of paper, if and when the thing starts to lock down like this, the fluid can start to accumulate and it starts to produce pressure from the inside. And so what's important here is that you've got the appropriate amount of fluid going in and the appropriate amount of fluid going out, because if you got too much going in, not enough going out relative to relative levels, well, you're going to start to get problems. Idiopathic intracranial hypertension. And we talked about this one in a previous video, but in brief, idiopathic, cause unknown, intracranial, inside, hypertension. This is very similar to the hydrocephalus. The hydrocephalus occurs when you actually have so much pressure inside of the skull that it actually causes it to start to expand. Idiopathic intracranial hypertension occurs when you have increase of the pressure occurring within, particularly of the arteries. And this then, same thing, it's producing too much pressure, and it often shows up as ocular disorders, but it can also be associated when there's too much pressure going through your arteries, which can be associated with strokes, brain bleeding. Again, not a very nice thing. Migraines. In contrast to a headache, which is irritation to the nerves of the head, a migraine is where you have irritation of the connective tissue around the brain. The brain itself does not have pain receptors, but the connective tissue around it sure does. And if these are ever irritated, whether through physical aggravation or chemical, which includes stuff you put into your body, but also hormones, you have not just the internal sense that your skull is ripping itself apart, but also a sense of nausea that goes with it, among other visual and also balance kinds of problems. Seizures. Think of it like this. It is where you have too much brain chatter going on in every direction in all ways, and it's a system overload. And when the system overloads, not too much unlike how a computer would freeze when you've got too much stuff running all at once, that's happening with the brain, ultimately then producing either absentees or full myoclonic kinds of seizures. Wide variety of different things there. Silent strokes, what are sometimes known as transient ischemic attacks, or TIAs, mini strokes. There's two general categories of strokes, what are called wet strokes and dry strokes. Wet strokes is where a normal artery going to the brain bursts and you have blood starting to spill out into the space. Blood is cytotoxic. It kills brain cells. So that's one way that you can cause damage. The other is what's called a dry stroke. And this is where it's not burst, but for whatever reason, it's clamped down. And now the brain's not getting the right amount of blood going to, and as a consequence, the tissue dies from lack of oxygen and energy. Now, in your brain, you've got, and really everywhere in your body, you've got big arteries, and then you have the 1 millimeter little diameter capillaries. This is what we're talking about here. We're not talking about obstructions or bleeding of the major arteries, but what we are talking about is where you can have the clamp down of these tiny little capillaries, potentially because of problems with the smooth muscles that regulate them. And the consequence of that is that you have local little tiny areas of the brain that are not getting the right amount of oxygen and energy, and they end up dying. And what happens is if you have hundreds, thousands of these tiny little spots, one in and of itself is not actually enough to produce symptoms. Most people aren't even aware that these things are happening. But then, if you start to have enough of these little things going on, then they start to affect brain function over a long period of time. And they just simply accumulate, and depending on what centers of the brain they have occurred, well, those are the kinds of symptoms people would be apt to experience. Affective disorders. This is going to refer to it's a wide variety of different things, but it's in brief, it's about how we perceive and how we experience different sensations coming in and how it manifests going out. So this includes our anxieties, this includes our depressions, this includes our spectral disorders, where the way that the brain is processing information, it's like not quite exactly the normal, and sometimes it might be normal for that individual, but it's not the common standard in terms of the way that the brain ideally would be functioning, showing up in a lot of mood disturbances, a lot of emotional disturbances, or just simply not being able to process emotions and then coming up with the right kinds of actions. Schizophrenia. This is where, same thing, brain is not processing right kinds of information, at least we believe, and the consequence is that we are seeing, hallucinating, and visualizing things that may not exist, leading in turn then to erratic action and oversensitization of different parts of the brain. And lastly, psychosis. Same thing, this is where brain again not working right and then causing us ultimately to do very destructive, oftentimes, not always, but destructive kinds of habits, behaviors, different things like that. So that's a bit of a broad-based summary. Oh my God, guys, we've only gotten through the first part here. We still have so much to go. We've already been going 15 minutes. Point here being is that all of these different centers of the brain are ultimately going to be influenced by the same thing. And so not a guarantee that this is what causes it, but we're going to walk you through to show you how is it all of these things can have a common underlying denominator and effect. Craniocervical hydrodynamics, Craniospinal hydrodynamics, which is referring to blood flow going up to the brain, down from the brain, and also circulating within and around the brain, refers to the relationship between blood and cerebrospinal fluid, the interstitial medium that bathes, protects, and gives the brain its buoyancy, its energy, its sugar, and also drains away basically any metabolic byproducts. So it's between blood, CSF volume, pressure, and flow in a relatively closed confine of the compartments of the cranial vault and the spinal canal. Malformations and misalignments of the craniocervical junction cause deformation and obstruction of blood and CSF pathways and flow between the cranial vault and spinal canal that can result in faulty craniospinal hydrodynamics and subsequent neurological and neurodegenerative disorders. I'm going to try to give you the brief summary of things here as much as I possibly can, and I will then highlight it going back in a few spots of this article. So what do we have for you guys here? We have a big giant model of the base of the skull right about here. So this is the bottom. This is the major part of the spinal canal located right here. Sitting right below that, we have this little guy. So this is a model of our top vertebra in our neck. This is where your spinal cord lives. This is where your brainstem is, which is what is responsible for controlling all of the vital life signals that regulate how this thing works, all of it, and also all the information going here, here, and everywhere in between. And you may notice that on the side, whoops, of this silly little model, you've got these couple of holes. Now, for the purpose of the model, that's for string, so it normally holds all this thing together. But through that opening, you're going to have what are called vertebral arteries and vertebral veins. The blood flow to your brain, there are two predominant pathways. There's what's known as the internal carotid arteries, which go along the front up through here into the skull and supply somewhere between 2/3 and 80% of all of the blood to your brain. But these vertebral arteries that transmit through your neck and do a little bit of a dynamic movement, in particular at this area, the craniocervical junction of the atlas and the axis, the C1 and the C2 vertebrae in the neck, they're going to go up and they're going to be supplying basically 20% up to 1/3 of the blood to the brain, but they're doing it to the brain stem. In effect, all of that local stuff that controls those vital life functions, including your cerebellum, which is balance coordination, all of the different nuclei that are responsible for your internal organs, everything that goes along with that. So in that spot, you've got the blood flow going up. You've also got the blood flow going back down. This is worth going back and reviewing on a completely separate video that we did, where in brief, what we identified was that you have two major drainage pathways from the brain back down to your heart. The major and preferred one is the internal jugular vein, which is going to follow the same course of the internal carotid artery, coming out through the base of the skull on the front of the atlas, through the middle part of your neck, and then ultimately back to your heart. However, that pathway closes, it clamps down when you are in an upright position. And so when you are in a lying down position, this is the way that's predominantly draining. But when you're upright, it's predominantly the second pathway, what's called the cerebrospinal venous system. It's where you have the blood drain from inside of the cranial vault and into this cerebrospinal system, which includes the vertebral veins, which are going to pass through that exact same point of the atlas and the axis at the base of the skull. And it's also going to include a series of what are known as emissary and basilar veins. You have a huge network of veins that are located on the inside, particularly the front side of your brainstem, that join in with these vertebral veins. And you also have a huge amount of them that are located across the back of the skull in the area between the base of the bone and where the top of that atlas vertebra sits. And all of those little venules come together and drain into this area in a way that is so complicated that it is not yet usually taught in standard anatomy courses. Why? Because standard anatomy is good for learning standard anatomy. These structures are more like cobwebs in their appearance. They are different in absolutely everybody. And so, yeah, we might see similarities, but we just have to refer to them more as these structures where the builders of our body came up. They knew that they had to create these structures to properly drain blood from the brain through the neck and then back to the heart when we are in this upright position. But it's as if the builder and the designer had said, be creative here, go for it, whatever you want to do. And so that's what they did. So that's the predominant drainage pathway that's coming out from brain to body. You've also then got what's called the cerebrospinal fluid. So the cerebrospinal fluid, I want you to think of it as the most pristine, clear water that you can imagine. And this is the medium that lets your brain work the way that it does. It's separated from all of the rest of the tissues in your body. It's separated even from the blood, so that the only things that are meant to be in it are the energy, the oxygen, the electrolytes, and then quickly draining away the metabolic byproducts, which drain through, they're called arachnoid granulations, which drain into that venous system and through lymphatic channels so that it's ultimately drained and dumped back to the heart. So the system is maintained and kept as clean as it possibly can, and it circulates around your brain just like this. And in fact, not just your brain, but your entire spinal cord. And in fact, if you were to pause right then and there where you are and feel, and not imagine, excuse me, that's the wrong word. I want you to feel down at the base of your spine, and I want you to feel up at the base of your head. And you'll notice that as you are breathing, if you do so smoothly and quietly, that what you'll feel is you'll feel this very gentle rocking sensation. Back and forth just like this. That's what's known as the craniosacral rhythm. And that is essentially the pump that your body uses to make sure that this cerebrospinal fluid keeps moving. And even people, if they are in a complete catatonic state, or psychosis, they will rock like this. Why? Because even if nobody's home right now, it's one of the ways that their body is actually working to keep that fluid mobilized so that they stay alive and keep working as good as possible. So these are the normal hydrodynamics that are involved in terms of making sure that your nerve system is able to operate the way that it is supposed to be. So let's go back to the article. To prevent damage to the brain from excess pulsatory pressure, the increase in volume must be matched by a simultaneous increase in drainage of venous blood and CSF from the cranial vault. In addition to the internal jugular veins, humans developed an accessory drainage system, this is what we said, comprising emissary veins that link to the dural sinuses to the vertebrovenous plexus that serve as primary drainage routes of the brain during upright posture. In other words, the amount of blood you got going up to your brain had better match the amount that's coming back down. So, what's the whole point that he makes in this article? We can summarize it in this one sentence right here. In brief, too late, the craniocervical junction is a potential choke point for blood and CSF flow between the cranial vault and spinal canal that can cause faulty craniospinal hydrodynamics and subsequent chronic ischemia, edema, and hydrocephalus. What are these? Ischemia is like if you were to block off your finger like this, you're choking off blood flow and it's not circulating the way it's supposed to be. Edema refers to the amount of extra fluid that congests in that area because it's not able to drain back. And hydrocephalus, this is the pressure because you got too much of that cerebrospinal fluid inside of the system. So how is it possible that the neck can cause all of that? Well, it's actually quite simple. When you take that atlas, and when you take the base of that brain, or the base of that skull, more appropriately, you recognize and realize that the thing is designed essentially to move like this. It's what's going to be providing 50% of all of your up and down head movements, and about 50% of all of your turning side to side movements. This is a very flexible area. It doesn't have a disc associated with it, but because of that, there's a trade-off. See, when you give up your structure, you lose the stability, but that's what gives you the flexibility. but it also means that that area is more susceptible to injury. And what kind of injuries? Well, you can have dislocations. Medical emergencies are what those are called. You can also have what are called dislocations, where the vertebra may completely shift off of where it is supposed to be. Also a medical emergency. But you can also have lower grade kinds of injuries. Not full-blown ligament or muscle tears, but micro tears from trips, falls, tackles, whiplashes, any number of head-neck injuries. In fact, even a knock on the tailbone is going to do this, because if you land right on your backside, it's going to cause a whiplash effect that can affect this. Why? Because this is the weak link in the chain. And what it can do is it can cause a micro tear of those ligaments in such a way that the vertebra actually moves in the way that it normally should, but then because that injury essentially damages the ligament, it can get locked and it can get stuck there, even by a couple of millimeters. And if it gets stuck there and it's suddenly not moving the way that it's supposed to be, then what it can do is your body's going to try to fix it to the best that it can. But if it's not able to overcome that from just simple rest or stretching or exercises or anything like that, it stays stuck. And the reason that that matters is because of everything that we just talked about so far. You see, a normal amount of movement at the craniocervical junction is really only about 10 millimeters or 1 centimeter in any direction. That's the size of the joint. But you can keep this in mind here. So I'll go back. I tried jumping ahead a little bit too fast there. So that's how much it normally moves. But I also want you to consider the sensitivity of this area, because this area is laden with nerve receptors, pain receptors, pressure receptors, and proprioceptors. Pressure receptors are what detect and regulate movement. Proprioceptors are what are responsible for balance and muscle tone. And you will note that those have nothing to do with pain. But don't worry, you do also have pain receptors. So my point here is that you can have a disruption potentially of any three of these, but you don't necessarily have pain or need to have pain for there to be a problem. So what will happen is, if and when you've got, that particular kind of injury, and again, you may or may not have symptoms, it can in turn then start to affect the way that fluid is going to and from and within your brain. How is that? Well, remember those vertebral arteries and those vertebral veins that we talked about? If those are what are supplying blood flow to the brain and from the brain, if this thing, this atlas or this axis, is offset by even a couple of millimeters in the wrong way, the orientation, and is not able to fix itself, that has the potential to represent a 10, sometimes even a 20% loss in movement and disruption in flow going up and down. And sometimes you can see this on MRI, special studies that are called blood flow studies, an MRA, so an MRA, so a magnetic resonance angiogram, or a MRV, magnetic resonance venogram, so measuring it on going down the other way, where you can see these potential choke points going on in the arteries and the veins, which represent that A, the brain is not getting as much blood as it was supposed to, or B, blood is not draining the way that it is supposed to. Now, typically from a pathological standpoint, these are not commented on in the standard reports until you're talking about a 50% plus deviation, where one is way more pronounced than the other. You can clearly see that there's an issue. But when you're talking about these 10 to 20% reductions, you don't always see that that's the case. But nevertheless, you can still see turbulence, and you can still experience the symptoms long before you start to observe the true blue signs of pathology. So very, very common in the early stages of these things. Any of these conditions, people will be developing symptoms and they think that it's either, quote, normal aging or, oh yeah, just something that'll go away on its own. But if the problem is found to perpetuate long enough, they may go and have a brain MRI or another scan, but the results end up saying, okay, nope, everything looks, quote, okay. Well, it's possible it's because the nature of that injury and the nature of the blood flow and the ultradynamics is simply not big enough yet for it to be then identified. And so the problem may go on for another 5 or 10 years before ultimately, now we're dealing with some more serious consequences here, without having realized that actually, there were the signs of it back then, but we just didn't know how to look for it quite as clearly, quite as well. So this is the importance then in understanding that the way that upper area of your neck, so the C1 and the C2 vertebrae, move, and if and when they get locked out of position orientation, they can disrupt flow to and from the brain. And if you want more information on that, I recommend you look up anything. The gentleman's name is Dr. Scott Rosa. He's an upper cervical chiropractor. He does a slightly different technique from myself. I used to do the method that he does. I now use a slightly different technique. But in brief, he has access to all kinds of really, really cool technology where he is demonstrating, and we'll probably do another video on Dr. Rosa's publications. He is showing that when you correct the alignment of atlas and axis, in his particular case focusing on atlas, that it actually does. This is not just a theory. It actually does change blood flow to, from, and within the brain. And if you start changing and restoring normal flow to those vital life centers, what does that have the potential to change? It has the potential to change somebody's entire life from so many, again, of these different kinds of conditions that can affect a person. So we've been going here for about half an hour, and really I think we've covered, this is the core essence of this paper. As always, we're going to share with you the link about where you can check out and read this one and go through it if you want as you do. But in brief, I'm just going to go through highlights of some of the different things. Recent clinical evidence by Raphael further suggests that that's what happens when you talk too much too fast. Amyotrophic lateral sclerosis may be due to progressive ischemia of the intraparenchymal territory of the anterior ventral spinal arteries, the anterior spinal artery. In other words, if you look at the neurology that's associated with motor neuron disease, it's going to be receiving and it's going to be given its function because of micro blood vessels that are coming right off of that upper neck area. And so if something, even a very light amount of pressure, is not letting the right amount of blood flow get through, well, guess what? The neurology is not going to work. And if the neurology is supposed to coordinate and allow the muscles to move, particularly those ones involved in speech and swallowing and breathing, you are definitely have the potential, at the very least, to have a pretty big issue. Many authors have also suggested that amyotrophic lateral sclerosis or motor neuron disease may be related to trauma, especially head trauma. What did we say? We said just because there's not broken bones and bleeding does not mean that everything is okay. You can still have these micro injuries, which is one of the major reasons why I am such an advocate that if and when a person has had a head or a neck injury, yes, get it checked out by the paramedics, get it checked out by the medical doctors, whether your GP or in the hospital, to make sure that you are not dealing with those life-threatening injuries. After that, get it checked out by an upper cervical chiropractor, because they are the ones who know how to look at this area of the body in high definition and high detail to identify if there actually is a problem that, even if it's not causing you pain or issues right away, may have the potential 10, 20, 30 years to show up in way more complicated and way more impactful kinds of ways. Because if you can get on top of it right away, then it doesn't have to affect you. It's a lot easier to stop a snowball at the top of the mountain than it is to try to stop it towards the bottom. Among other things, trauma can tear ligaments of the craniocervical junction, resulting in joint instability and misalignments. Misalignments due to degeneration and ligament laxity are associated with connective tissue disorders such as rheumatoid arthritis and Ehlers-Danlos syndrome. Rheumatoid arthritis, Ehlers-Danlos, we talked about the latter in a previous video. It's genetic susceptibility where the ligaments are a little bit more stretchy. These conditions that we're talking about now, they don't cause it. However, if you have all of these things combining, and that's really the point, there is no one smoking gun. But when you have the combination of multiple different components all occurring at the same time, that is then how these issues in the neck can at the very least be a contributing factor towards what a person is experiencing and what they have going on. This is kind of an awesome picture if you like these kinds of things. This is showing the drainage pathways of the brain. This here is that internal jugular vein that we talked about. You see how big it is? That's why it's the preferred pathway. But remember, when you're in an upright position, that's actually closed down. And so the predominant pathway is through all of these tiny veins that you see here that drain the brainstem, base of the skull, and then transmit down through the neck via that vertebral vein. But if you've got that atlas or axis sitting off kilter, then you can have a choke point going on where it's not draining here and it's not draining here. Well, guess what that can do? That can start to cause a pooling up kind of effect. And so, yeah, you have the right amount of brain going, or blood to the brain going up, but you're not having the right amount coming back down. And if you don't have the right amount coming back down, it starts to accumulate on the inside, where it starts to build up the pressure, where it starts to irritate the lymphatics, where it starts to spill back into the cerebrospinal fluid. So instead of it being this beautiful, pristine environment, the hypothesis is that it starts to become a little bit dirtier. And if it's dirtier, your brain is not going to work quite as well as it would, and over a period of time can cause damage. So this is just a few pictures of how that cerebrospinal fluid works. It's also related to what are known as Chiari malformations. In brief, a Chiari malformation is where you've got a herniation of the brainstem into that area right through here, which can be either a developmental kind of issue, or it can be because you've had a whiplash injury and it's pulling and putting pressure on your brainstem in such a way that it's actually herniating out the base of your skull. And the problem associated with Chiari malformations, and also what is known as cervical medullary kinking, which again occurs as if you have certain developmental anomalies of the brain, is if you have the normal amount of space where that's all supposed to come out, but you've got too much mass there. Instead of the normal space where the fluid can flow out and down and around it, there's not as much that's able to get through. If it's very severe, people may actually need a surgical shunt to basically get everything flowing the way that you should. However, it's possible here again that, okay, if the cause of that is because something's not sitting right, and that's what's putting the pressure there, you can actually see changes in the fluid and even the CSF flow dynamics, and even the Chiari malformations by addressing the mechanical issue in the upper part of the neck. So I'm just looking to see if there's anything else that's worth, going through. I mean, I've highlighted again a few of the bits and pieces here, but pretty much covered most all of the things. Neuronal injury may result from several factors: mechanical stretching of the anterior cerebral arteries, periventricular impairment of the blood-brain barrier, reduced CSF flow turnover, decreased elimination of neurotoxic substances such as beta amyloid, tau protein, pro-inflammatory cytokines. These are things that are found in the CSF and in the brain tissue of people with Alzheimer's disease, is the short of it. And what the hypothesis here, as I had just said, is if you have the backflow and the accumulation because you're not able to get the right amount of drainage, these normal metabolic byproducts back up in the system. There's a supply chain issue. And essentially what's happening is then they start to cause the damage that's associated with these kinds of issues. Now, they do also refer here to periventricular impairment of the blood-brain barrier. What this is referring to, and you may recall in the very beginning I had said that your brain is completely separate even from your blood flow. The blood-brain barrier is a very highly selective membrane that only lets very particular substances through: water, oxygen, sugar, certain electrolytes, and under very tight regulation and restriction. The point here, because certainly any and all of these conditions, you very likely have heard that there's related to chemical toxicity effects. And the answer is you're absolutely right. You see, when you have been in and around industrial pollutions, heavy metals, or other toxins and other things that can go on in the body. That normal tightness that should occur at that blood-brain barrier can start to get loose, and stuff can start to filter through it, stuff that should not be getting through. And that in turn can cause the inflammation and the damage in the brain because of the leakiness of the blood-brain barrier. And what we've just said right there is a completely different mechanism, a chemically induced mechanism by which, guess what? You can develop all of those exact same kinds of conditions. And this is probably then a good a place as any to wrap up this little video, is taking us all the way back to the beginning and the understanding and the appreciation that with the vast majority of these conditions, we're not talking about just one thing that's going on. Because let's face it, if it was, surely somebody would have been able to discover it by now. And surely somebody would have been able to find out a solution, particularly if you have a loved one who deals with one of these kinds of things. Somebody would have been able to find a solution to be able to help them. So the reality is that it is very likely a more complicated condition. Why? Because just because we may call something Alzheimer's, multiple sclerosis, migraine, the pathway that got you to each one could be different. It's possible that a person has a chemical issue. They have the leakiness of the blood-brain barrier, and that is what is producing their issue. And it may have nothing to do with their upper neck. Or it could be the other way around. It could be that chemically they're perfectly fine, but they got an issue right here, and the consequence of that is it's screwing around with the way that that fluid is flowing, and that's why they experience the issues. Or maybe they have both. And maybe they have both, and then they also have other things that are going on. Genetics, certain amounts of stress, and other kinds of issues in their body that, we can't even begin to get into in this particular video. My point being here is there's not linear A to B relationships with these kinds of things. There are many factors that need to be considered and many factors that need to be addressed if and when people are looking for resolutions for these things. And that's why when you go on the internet and you go to the chat forums and you're looking for help on XYZ disease, you see so many different bits of information, including the medical side of the equation, which, in my opinion, ideally should be to help do whatever is necessary to help with the symptomatology while you're looking to identify what the underlying cause is, to give your body the best opportunity that it possibly can to heal from these things. Sometimes the solution might be relatively simple. Other times it might be far more complicated and can involve quite a process trying to identify all of the bits and pieces. So where we end then here is simply, if or where you may be experiencing one of these, I ask the question, have you had this area checked out? If you're looking for answers, solutions, you're looking for better ways of dealing with these kinds of diseases, you want to make sure that you're not going into a boxing ring against the heavyweight champions of the world with one hand tied behind your back. You want to make sure that everything is working, flowing as well as it possibly can from above down, inside out. And a good part of that, as we've walked you through in this particular article here, is showing you how it's possible that something here could be one of, maybe not the only, but one of the missing pieces of the puzzle. So, what do you do at this point? Well, firstly, if you haven't already done so, click that like and subscribe button. Again, that really helps me out if you've enjoyed, if you found value in watching this particular video. Number two, if you're looking for more information, I recommend that, firstly, go to our website, which is atlashealth.com.au, where we have all kinds of different articles that take you through a little bit more of this information about what we do in the practice here in Brisbane, about what we do for people who come across Australia and other places where they're looking for help for what we can do to address these kinds of issues and how they may be impacting their ability to be well. So it'll give you a lot more information. I do also recommend you go to blairchiropractic.com, where you can find, if you are not in the Australia zone, where you may be able to find somebody else in the world, if you're watching this video, so that you can find the help that you need so that you can get the kind of outcome that you're looking for. The second thing, actually no, excuse me, that was the second thing. So the third thing now is that if and when you have a friend or a family member who may be experiencing one of these kinds of things here. What I would ask you to do then is to please share this video with them. Send that same kind of link and this information there. It's because, especially when people feel that they have one of these terminal sentences, either A, that this is how their life is going to end, or B, that this is something that's going to make their life very uncomfortable until the end, that there may be other possibilities that they have not yet explored. Even if they've done the medical route, and again, it's a good thing, even if they've done the chiropractic and the physiotherapy and the acupuncture and the nutrition, these are all very, very important. It's also important then that you make sure that you have that one particular center sitting and oriented the way that it should be, as good as it possibly can, so that you've got that best opportunity of being well. So please do share this with them. I would be optimistic then that it could make a difference. And then if you are in the Brisbane area, please do reach out to us. We've got the contact details at the end of this video where you can get a hold of us. We'd be happy to have a chat, answer any questions you have, and then, give you all of the resources and tools so that you can decide, is what we do, is that something that may be able to help you out as well. So we made it mercifully to the end. Thank you guys very much for watching this video. I do hope that you've enjoyed. We'll add a few of those cross links to some of the other articles that we've talked about over the course of these videos here. And so that will keep you busy, I'm sure, for a little while. So we'll leave you on that note. Until next time, everyone, take care. Bye-bye.